Patient stories reflect personal experiences. Individual experiences may vary. Check with your doctor to see if Vivitrol plus counseling is right for you.
There's a couple of motels on this road that are considered one of the worst places to be, and this is one of them. I went from being Mr. Youth Minister and that kind of guy to this is one of the first places I shot up in room 115 right here. Not only was it where I got started, you know, really using hard and that type of stuff, but it's also a place where I could have been robbed, it could have been shot. I would come there and that's where I probably used drugs and shot up more in that basement than anywhere. And you know, the guilt and the shame and the remorse, because for me to come get buy heroin in a place like that, you know, that directly goes against all my values. Never thought in a million years I would ever get to the point where I'd do something like that. I can still have that feeling of it being so real that that was going to be my life. My name's Kurt. We're in Powell, Tennessee, outside of Knoxville, Tennessee. I have a degree in biblical counseling. I was very fortunate to get my degree in counseling before I started using. Never got arrested during my time using. I very well could have. I was one of the guys that I was the president of Fellowship of Christian Athletes and was, you know, in church a lot when I was in high school and that type of stuff. And I always stayed away from, you know, drinking and drugs and that type of thing. And I had a ruptured disc in my neck and giving me a lot of trouble. I went and had surgery on that. After surgery, I got some Percocets. Took more than I was supposed to. When I was taking the opiates, it had the effect on me that I was happy-go-lucky, you know, fun guy, you know, for a while. Of course, then you'd start nodding out and being, you know, isolating. Problem is that, you know, it took more and more. At one point, when I was going to the pain clinic, I would probably eat 20 of them a day. Was able to take my MRIs and my X-rays into a pain clinic and just get, you know, whatever I wanted. I had to have that much to feel normal, you know, to not feel depressed and sick and that type of stuff. You know, you have to use a lot just to get up to where you feel okay. This is where it quits being fun to use and it becomes a job. It becomes miserable. You know, your existence is completely obsessed and focused on drugs. And all the guilt and the remorse and the shame of all the stuff that you're doing is, you know, building on top of you, but at the same time, you can't quit using. My dealer one day said, you know, if you shoot this, the term he uses, bang it, then you'll get a lot more bang for your buck and you won't have to spend so much money. And the first time I shot up was, I mean, it was probably the best feeling I ever have this side of heaven, just to be real honest about it. Little did I know, you know, that it was what it was going to do. I very quickly went to shooting up multiple times a day. Very quickly went from the pills to heroin. I'm a firm believer in the 12 steps because it causes you to deal with, you know, the stuff that's in deep inside you and get a lot of that stuff out. And I went to a few meetings and, you know, and I would still use and I would quit using for a few days and then I'd really start getting sick and stuff and I'd go back and use. And I actually stayed clean for a few months and was going to a lot of meetings and that type of stuff. But then it ended up relapsing. I didn't understand why I kept relapsing, and I felt really, really defeated. I'll never forget, one of the things that can, help me stay clean now is coming over these railroad tracks. I had money in my hand and headed over to my dealer's house, and I thought, you know what, I guess I'll just do this for the rest of my life. I just, at that point, I just had no hope, I was done at that point. I had woken up that morning and I was gasping for air, and I couldn't really feel my arms and my legs good. I had done 90 milligrams of morphine and I think 3 points of heroin in a matter of probably 6 hours, 7 hours, and that's a lot, and so I was completely out of it, woke up, and my addiction told me I gotta go get more. Got in my car, got to the end of the subdivision where I was at, and stopped in the middle of the road. And I have no other explanation for it than God just stopped my car in the middle of the road. And I had this moment of clarity is what I call it, but all the stuff that I had done kind of came crashing in on me. The stuff I'd done to myself, to my wife, to my children, to my friends, to my family, was all clear to me, very, very vividly clear. I knew that I needed to probably go to rehab and actually get, some time away and really deal with the stuff I need to deal with. My sister-in-law reminded me of a friend of ours. She's had been in the recovery world for a long time. She called and they actually sent a van from Mississippi to pick me up. And so I packed my stuff up and called my kids and told them I loved them, and got in the van and went to Mississippi. And I remember getting in my phone and, erasing all my contacts of people that I didn't need to speak to anymore, and really trying to, I was done, and I got down there, and it was just the perfect place for me. I was clean for a year, and it's been a great year. Learned a lot. I've got a very active recovery program. Go to a lot of meetings. I talk to my sponsor every day. I'm doing step work. All the things that I'm supposed to do, I'm doing. I got to the point where I've educated myself a lot on relapse prevention. I started doing a little homework on how Vivitrol works. Did just a little research, found a doctor. Went to the doctor. They explained the whole program, that you're getting counseling, that you have a recovery program. I know that it's the only FDA-approved drug for relapse prevention, and that's very important to me. Vivitrol is a shot that you take once a month. It's not a drug replacement. It's not addictive.
Vivitrol is a once-monthly prescription injectable medicine used to prevent relapse to opioid dependence after opioid detox. Vivitrol must be used with other recovery programs, such as counseling. It is not known if Vivitrol is safe and effective in children. Vivitrol may not work for everyone. See the medication guide for more information. You should not take Vivitrol if you are using or have physical dependence on opioid-containing medicines or opioid street drugs, are having opioid withdrawal symptoms, are allergic to naltrexone or any of the ingredients in Vivitrol.
I'm not doing Vivitrol because of some sort of huge gap in my recovery program. I'm doing it because it's a tool that's available for my recovery. I don't know how long I'll continue to take it. That's something that I'll talk over with my doctor, and they understand what Vivitrol does, and they're, they want to, again, making sure that it's part of a recovery program, that you're not just trying to use Vivitrol and, that's it.
You must not take any kind of opioids, either street drugs or prescription, for at least 7 to 14 days prior to starting Vivitrol to avoid sudden opioid withdrawal that may be severe enough to require hospitalization. Using opioids, even in small amounts while on Vivitrol, can lead to accidental overdose. Because Vivitrol blocks the effects of opioids, anyone who tries to overcome that block by taking large amounts of opioids could be at risk for overdose, serious injury, coma, or death. Some patients had severe skin reactions, including tissue death at the site of the injection. Some required surgery. Call your doctor right away if you notice intense pain, blisters, the area feels hard, an open wound, swelling, a dark scab, lumps, or any other skin reaction. Additional important risk information is presented later in this video.
One of the things that I have to really concentrate on that's really easy to say that's hard to do is living in the moment, just for today. I can't let the past affect what's going on today, and I can't worry about the future. I just have to do what's the next right thing today. The consequences of my addiction will be with me in some form or fashion the rest of my life. I don't want to go back there. Today I'm choosing to move forward and not let that be a deterrent, but be a encouragement to do the right thing. If there's something out there that's going to help me, then I'm going to use it.
Additional important safety information about Vivitrol. Do not use opioids in amounts that you used before Vivitrol treatment. You may even be more sensitive to lower amounts of opioids after detox, when your next Vivitrol dose is due. If you miss a dose of Vivitrol, after you stop Vivitrol treatment. Get emergency medical help right away if you have trouble breathing, become very drowsy with slowed breathing, have slow, shallow breathing, feel faint, very dizzy, confused, or have other unusual symptoms. Tell your doctor about any injection site reaction that concerns you, gets worse over time, or does not get better by 2 weeks after the injection. You must be opioid-free before receiving Vivitrol unless your doctor decides that you don't need to complete detox first, in which case he or she may give you Vivitrol in a medical facility that can treat sudden opioid withdrawal. Naltrexone, the active ingredient in Vivitrol, can cause liver damage or hepatitis. Tell your doctor if you have any of the following symptoms of liver problems during Vivitrol treatment: stomach area pain lasting more than a few days, yellowing of the whites of your eyes, dark urine, tiredness, depressed mood. Sometimes this leads to suicide or suicidal thoughts and behavior. Tell those closest to you that you are taking Vivitrol. You or those closest to you should call your doctor right away if you become depressed or have any new or worsening depression symptoms. Allergic pneumonia. Tell your healthcare provider if you have shortness of breath, wheezing, or a cough that doesn't go away. Serious allergic reactions. Get medical help immediately if you have a skin rash, swelling of your face, eyes, mouth, or tongue, trouble breathing, or wheezing, chest pain, or are feeling dizzy or faint. Common side effects of Vivitrol include nausea, sleepiness, headache, dizziness, vomiting, decreased appetite, painful joints, muscle cramps, cold symptoms, trouble sleeping, and toothache. These are not all of the side effects of Vivitrol. For more information, ask your doctor. Tell your doctor right away if you have any side effect that does not go away. See the medication guide for more information. Call your doctor for medical advice about any side effects. You are encouraged to report negative side effects to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088.